Hello guys, welcome to our channel Homoeopathic Trials. We come up with videos on different topics of homeopathy. So please do motivate us by liking, sharing and subscribing to our channel. In our today's video, we will explain you the remedy Antimonium tartaricum. Antimonium tartaricum, the common name tartar emetic. Antimony comes from 5th row of the periodic table. The main feeling of antimony is a feeling of disappointment and the need to isolate himself from the world. Now, having the idea of the main feeling of antimony, now let's dive into the mind of antim-tart person. A person of antim-tart is usually in a situation where he is very disappointed by something and thus feels very sad. The patient has disappointment in love or any other thing which makes him sad. This sadness brings in hopelessness in her and thus makes him peevish. Antim-tart child is quite clinging in nature. He keeps on crying until his mother does not carry him. The child would also not allow the physician to check his pulse. The child is always crying for his mother. An antim-tart person is extremely fearful. He gets frightened at trifles, that is, at every smallest thing. He is very scared of being alone, as he likes to be around people. Antim-tart is a remedy which is known for its respiratory symptoms. Now let us check respiratory symptoms of antim-tart by starting with the cough of antim-tart. The cough of antim-tart is very short and is in quick successions, which is excited by tickling in the throat. It is also a very good remedy for whooping cough, which is aggravated by eating and in anger. Antim-tart is a remedy which is known for its wonderful action in cases of pneumonia and thus has served a lot in the current pandemic of COVID-19. It is a very useful remedy in the later or advanced stage of the disease, when the chest of the patient is full of phlegm and mucus. Now, when such a person coughs, it causes a very loud and hard sound which is known as death rattle. The patient of antim-tart feels suffocated at midnight, that is at 3 am, and has to sit up straight to be able to breathe. Antim-tart is also a very good remedy for Asiatic cholera. Asiatic cholera is a severe bacterial disease which usually causes symptoms like diarrhea, vomiting, etc. It is usually a waterborne infection. Antim-tart works wonders in such infections. The patient of antim-tart has severe vomiting and diarrhea, which is so severe that the patient faints at the end of diarrhea. The vomiting of the patient is only better by lying on the right side. The patient also has nausea, which is better by vomiting. At the end, we will have a look at the physical general symptoms of antim-tart. Now, these physical general symptoms of antim-tart will give us a clinical hint while selecting this remedy. The tongue of the patient is coated thick, pasty white with red edges and there is dryness of tongue in the middle. The patient is thirstless with almost all his chronic ailments. The patient has a deep desire to sleep with almost all his complaints. And last but not the least, the patient of antim-tart has a deep desire or craving for apples.